morning, Mrs. Smith. My name's Sandy. I'm here to do your nail care today. First, let me go wash my hands. And I definitely want gloves on for this skill. So I'll put my gloves on. I'll check to make sure her wheelchair brakes are locked. And they are. And I'll pull the privacy curtain all the way around the bed or around her wheelchair. And I will ask Mrs. Smith to go ahead and soak her nails. And I'm going to want her nails to soak for about 5 minutes. So we'll let her soak for at least 5 minutes according to the state. And you don't have to let her soak the full 5 minutes. You can just verbalize that she has soaked for at least 5 minutes. After she's soaked, I then want to take the orange stick, which I've gathered ahead of time, and I want to clean up underneath her nails. So I will clean with the orange stick using the flat side of the stick, not the pointed side. I will clean underneath the nail and I'll wipe the dirt off on the paper towel. And I'll do that for every fingernail until I get her nails entirely clean up underneath. Once I've finished with that, I can then dry her hands. And I want to pay particular attention to between her fingers as I'm drying. I want to dry thoroughly between her fingers. Okay. And then I could use nail clippers and clip straight across, but for the state skill, we're not required to do that. We are required to take the emery board and file the fingernail, so I'll start at the outside corner of the nail and I'll file toward the center. Outside corner toward the center. And I'll get the nail nice and smooth. Top off any points that you've created. Take your finger, and this is very important, take your finger, run across the tip of the nail and make sure it's smooth. Then go to the next finger and file it the same way. Outside to center, outside to center. Check and make sure it's smooth. And you'll have to make sure that you do the same thing for every finger on Mrs. Smith's hand. You only have to do one hand for the state test. Check it, make sure it's smooth, and then go to the last finger and file it smooth. And check. Make sure you dust off any nail dust off the fingers. Make sure it's smooth. After you've done that, you want to take the washcloth and you want to push the cuticles back with the washcloth. Don't use the orange stick because that can damage the cuticle. So I'll take her fingers and push all of the cuticles back, the washcloth. And when I'm finished, I can start doing my exit steps. So I've taken my emesis basin to the bathroom and I've cleaned it and disinfected it. Remember, some facilities will want you to discard the dirty water in the toilet. Others will allow you to use the sink, so make sure that you know your facility's policies. Discard all of the dirty linen in the dirty linen hamper. Discard any nail equipment that you have used. Take one glove off. Use your gloved hand to pick up the emesis basin and your ungloved hand to open the door to the bedside stand and store your emesis basin in the bedside stand. If there's any dirty linen left, go ahead and pick it up. I'm going to lift your arm, Mrs. Smith, so I can gather your linen. And I'll throw it in the dirty laundry hamper. I'll take my other glove off and discard of it in the trash. Give my patient her call light. Is there anything else I can do for you, Mrs. Smith, before I leave? Well, if there is, then you just put your call light on and I'd be happy to help you. Open the privacy curtain and wash your hands.